So hi, welcome to a slightly different video from the CTAD Clinic. My name's Dr. Mike Lloyd and I'm the clinic director. So also on the screen, you'll see we have M, who is autistic and also has dissociative identity disorder, DID. So M has very generously agreed to an interview today to talk about life and experiences with both autism and DID. So we're going to be sort of going through a series of questions to talk about what it's like as an autistic person with DID and hopefully sort of come up with some hints and tips along the way for things that might be useful for sort of people to know from both a therapist and a person with lived experience perspective. Because one of the things about this is that while we might be identifying autism and DID as sort of like specific conditions to sort of think about, it's really important for therapists to be able to understand how these two combine and can work together or sometimes work against each other when we're looking at sort of recovery and healing from trauma-based conditions. So welcome, Em. Thank you very much. Thank you very much for sort of jumping in today and being willing to sort of like share your story and share your thoughts about things. So just to start with, before we jump into the questions, why do you think this is an important thing for you to be doing today? Like, why have you given us all your time to do this?
So, when I became aware that I was autistic, I started to learn about how autistic people understand and comprehend the world. And one of the things that I noticed is that we learn in a very specific scenario-based way. And I found that since I've been talking to other autistic people with DID and giving them an example of what that could look like, it made it tangible to them and they were able to put the two together.
So that sounds like this is going to be a really useful thing for lots of people to try and get their heads around and understand. I think this is going to be very valuable, hearing about your life and how you understand DID in a way through the autistic lens. And I know we've had lots of questions and comments over time on the channel from autistic people who are sort of looking for sort of specific answers really about what it is to be able to work with this. So this is a really great opportunity to answer some of those questions from your perspective. So you're okay if we sort of jump in and start looking at some of the questions that we've put together to think about what would be useful today.
That sounds great.
Fantastic. I think one of the key things is trying to understand what the differences are about, say, like a person having DID and an autistic person having DID. So what do you think about are the sort of the key differences that exist with being autistic and having DID?
So I would say the number one thing that I noticed originally was that I had to put more effort into grounding and I had to do that in a different way. And I had to manage my window of tolerance more because it could get full up by different things like sensory processing difficulties, social communication. So I've just got so much more to process. So that makes maintaining the bit of window of tolerance that I do have more important.
And so you've instantly mentioned the window of tolerance, which is something that I expect a lot of people will know, but may not also. What does the window of tolerance mean to you? How does that apply?
So the way it was explained to me is that you have a window, which is like your calm zone,
Mhm.
and then you can either go outside of that window into hyperarousal and maybe have flashbacks or something, or you can go under your window into hyperarousal and dissociate. So for me, managing my window of tolerance means managing the bandwidth in the middle.
So being able to do that, that sounds like that's quite a lot for you to be taking on and working on at any given time. So is this quite a tiring concept for you to have to put together?
Yeah, because I have more to process than other people because my brain is detail oriented. So I pay attention to a lot more than most people. I'm not able to filter out things and work out what's important. Everything is at the same significance for me. And then because there's a disconnect between my body and emotions, if I'm experiencing depersonalization, I still might struggle once I've grounded myself to understand what I'm feeling inside and interpret communication from my parts. So there's a lot going on in there. And
Mm.
every time I have to connect with a part, I'm shifting states in my mind from being focused outside to inside. and then all the demands of the external world on top of that.
That sounds like a huge amount, and I think what we'll do, we'll try and break down some of those things to make some sense out of it, to work out how you've done it, and then what the sort of the learning points are from this. What we've got from the sound of things then is that obviously, you're autistic, and that sometimes might act as a barrier to communication on the outside world and possibly on the inside world. And I'll ask you about that. How, in terms of the autism, how have you got used to your dissociation with being autistic? I mean, what's the process by which you can put those two things together?
So shall we break it down by the types of dissociation? Because that's quite a big question.
How about, so maybe I'll rephrase the question
Okay.
to go into, so autism clearly is something that has to be taken into account when you're thinking about your dissociation, but also just how you're navigating things out in the world.
Mhm.
I know you've always been autistic because you are. Have you always known that you were autistic?
No, I didn't. And before I knew that I was autistic, life was really difficult. I didn't know how to ground myself. So I was following the typical guidance of, use your senses to ground yourself. And so I would get sensory overload every time I attempted to do what was the right thing. And it took me a really long time to separate the sensory stuff from grounding and learn how to ground myself without overstimulating everything. So now I use things like bilateral stimulation, and I use butterfly hug. So you link your hands together and you tap either side, and that brings both sides of your brain back online. And I also use headphones with 8D music, and which alternates the sound in the ears so that
Sorry,
it's bringing you back.
8D music. I'm not sure what
Yeah.
that is. What does that mean?
It just means that the sound is alternating. And there's also 9 and 12D music for those who are ADHD and need a bit more stimulation.
Okay.
That's too much for me. But with 9 or 12D, the music goes in one direction and the voice goes in the opposite. And it feels like it's kind of circling around you. So it really does make you concentrate and focus and bring your brain back online.
Okay, so you've talked about quite a few things for grounding within that. Presumably you have to prepare quite a bit. So do you have like a grounding kit or something along those sort of lines to use when you need it?
Yeah, so I have a backpack which is pretty much always prepared to go outside. So there's fidget toys in there because movement and stimming's a good one, but I don't always want to do that in public.
Yeah.
I have sunglasses with me to manage the sort of light input. I have earplugs that filter out distressing tones and noise cancelling headphones if I need extra protection, like if I'm in the supermarket or something. And I know that with my parts, some of them being young, they can get quite hyperactive and fidgety. So I'll take things like coloring books and pencils if I'm like going away on holiday, for example. So yeah, I do have to think about it, but it doesn't take a lot of thought once you get used to it because it becomes part of your routine. So I know if I'm going to go to a certain environment, I always need the same things.
Okay.
If I'm going to a medical appointment, I might have extra things like a scarf with my favorite perfume. Anything that reminds me of my life now and separates me from the past is super helpful.
That's really interesting because a lot of the stuff that I talk about in therapy with DID is around this concept of signposting, which is being able to predict in advance that you think something's going to happen, which might be difficult or problematic for you, and then sort of prepare accordingly, whether it's internal communication or take stuff. And that's something that people really struggle with because it's hard to predict random things like, say, triggers in the environment or things that you hadn't really expected. From what you're saying there, it sounds like because you're autistic, you have a load of stuff with you that helps with that, but that can also have like a really secondary beneficial effect if things get difficult in the environment and might trigger some aspect of dissociation.
Yeah. I think that the challenge with it from an autistic perspective is that we like to plan ahead. So that's great. That's a
Yeah.
great skill. We can lean into that. But I know for myself, I tend to overthink, trying to plan for every single scenario that I might come across. So one of the ways I've combated the overthinking so that I don't put myself in hyperarousal, being anxious about everything that might happen. And I have a pretty good imagination, so it can get pretty vivid. So what I actually do is I tell myself 90% of the things that I do on a daily basis are exactly the same. And it might be sort of like 5-10% that's different. And so I will tell myself the whole time, I've gone out the house, I've gone to this place 10,000 times before, it's not going to be any different. And that
Right.
really calms down my anxiety and tells my brain that there's not much change. And then the change is only that last little bit. And that's what I will pay specific attention to before I go out to that appointment or that place. And I will work on what do I specifically need. So, for example, I've just been away on holiday.
Mhm.
I would normally take my squishy ball with me, but I can't take that because it's made of gel, so I can't put it on a plane.
Oh,
I
wow,
also
of course.
knew that I was going to be sitting on a plane for 10 hours with a hyperactive little, so we took colouring books, which is not something I'd normally take elsewhere. I'd normally just get to play a game on my phone while we're waiting to go into the doctor's appointment or something. So
Wow.
that's how you can kind of make things smaller so they don't feel so overwhelming.
And yeah, it sounds a bit overwhelming because I mean that's a huge amount of thinking that you have to put into this. Do you get to a point where you think I've done enough, I've contingency planned enough? I mean, how do you know when to stop thinking about what the eventualities might actually be?
Okay, so the main tool I have for that is to do the planning before the event
Yeah.
because I know that in the moment I will not have the emotional or processing capacity to think of all the things. My anxiety will just escalate. So if I plan for the 90%, I over time have learned to trust myself that if there's a surprise, I can cope with it because I'm only coping with that small change. Does that answer your question?
Yeah, it does because it sort of feels like because you're autistic, you have a really good need and an ability to plan and structure things, but also it can be in the way of knowing when to stop because it's almost infinite about what you can think about. So you set yourself like a threshold. Once you've got to a certain point, you think that covers enough, and then you're good to go and you get started.
Mhm.
You've had to work out then what is enough based on experience and reflection and a sort of an understanding of those things.
Yes, and we also have a system inside where if something unexpected happens, my littles will tend to freak out because they don't like change, whereas I, as the adult self, can cope with change and I'm a bit more flexible. So we have inner spaces that are closed off from the world. So they will go into those spaces, or they might even choose to. So say we're going to the doctor and they just hate the doctors, they don't want to know. They'll go inside. I will communicate with them the whole time from the outside, but I won't get the feedback. So that allows me to have processing capacity in the moment and not be overwhelmed by everyone else's feelings. But when I get home,
Yeah.
I know that I need to ground myself as that adult to process my experience and then ask my parts, hey, how did you feel about that? And sometimes it takes them a while to respond,
Okay.
but just making those separate spaces and keeping things separate really helps.
That's an enormous task for you. So you talked about, you're the one you're the sort of the face of the outside world then, realistically. So yeah, does it feel like a balancing act that you're both trying to negotiate the outside world and listen, notice, and pay attention to your inside world? So that feels like a balancing act that you're having to do. Does that tire you out? Is that something that causes you much difficulty, or are you just naturally brilliant at it?
I wish.
Okay, that
Um,
kind of answers that question, right? What's it like?
it takes a lot of effort in the beginning. But I would say the more you practice it, the more it becomes second nature. It's a bit like grounding. If you practice
Hmm.
grounding when you're calm, it becomes your default response when you're stressed. And it's the same with your routines about how you cope when you go outside. And the more my littles get used to it, the more it's familiar to them. So that's
Yeah.
kind of clever, really, because in a way, like even the unfamiliar can become familiar to them. And so it's just adding that another layer of safety.
Mm.
But I think the underpinning difficulty for me as the person who's managing like who comes to the front or not, well, ideally, it doesn't always work that way,
Yeah.
is that I have to manage state shifting. So I might have a part who is stuck, say, in 1990, and it's 2024, and they're responding from trauma time because that's where they're at. And maybe I haven't got to know them yet, so I don't know what they need. And I find being present with them in the past, focused internally, that's two different states. Myself outside, being focused in the present, plus anyone that I'm talking to, processing what they're asking of me, doing the conversion in my head of their generic concepts to my detailed brain and back. That's a lot of processing for me, which is why we have these internal spaces so that I don't have to do all of that all at the same time for the majority of the time. Obviously, there's still new parts that will come out and say, hey, I'm here, and I have to go through that with them.
Yeah.
But by reducing the amount of time I do that, and I only have to do it with one new part because I have a large system.
Yeah.
Yeah, it
Yeah. There's a couple of things there I'd like to unpick. I think one, that's you've offered a really good tip in there. So to advice of folks that are listening, and this isn't just about autism and DID, I think for DID in general, that practicing is you practice to do something when you don't need to be doing it. So you have to think in advance what I might need. This is part of your backpack, your toolkit, really. That you work out what you might need to do and you make sure that you're good at doing it before you need to do it in the moment. One of the things that's difficult that we hear as therapists is folks saying to us, well, I got into this situation and I kind of fell apart and I started, having this big anxiety or trauma flashback. How can I deal with that next time it happens? And we're giving your advice really of saying, well, you have to practice all of those things, work out what's going to work for you before it happens. Because when you're in the middle of it, it's too late. Realistically, you've only got what you've got. Introduce something new in that capacity is very difficult. So as a piece of advice to everyone listening is get your preparation done when everything's calm and straightforward so that you're prepared in advance. The other thing you mentioned is about processing time. So how do you organize that processing time? Because as an autistic person, you're having to deal and interpret lots of feelings and lots of responses, reactions, maybe a lot of noise coming from inside. And the noisier it is outside, my guess is the noisier it might get on the inside, and you're in the middle, acting like a buffer zone to all these things. So what's your, how have you worked out how to sort your processing time out for these things?
I think that pacing has been a really big part for me because I know that, if we go back to the window of tolerance, if, a regular DID person might have, say, that much trauma. I'm not being specific, I'm just trying to come up with an illustration. So say that much is trauma, and then that much is autism, and I might have like that much left. So maintaining my slither is really important. But if I have got to the scenario before where you said that it's too much and I'm overwhelmed, I have to just forgive myself for the fact that I've got to that point and say to myself, okay, I'm going to have a meltdown. Suppressing it is not healthy for me. So I need to just get away from the situation and regain my capacity, have the meltdown, let the vent go off the pressure cooker and restabilize myself. In an ideal world, if everything goes well and I've prepared and everything goes according to plan, then afterwards I still know that I'm going to be tired because I've had to put in that energy. So I plan sort of lag time. So like in project management, they give you a 20% buffer for you to overshoot for
Sure.
things to get delayed. I basically do the same thing, but in my own life. I just give myself a chunk of time when I come back. So for example, if I'm going to my art group, I love my art group. They're very loud and it's very chaotic.
Yeah.
And I lose myself because I get excited. So I'm not as mindful because I'm into whatever I'm into.
Yeah.
So when I get home, I have like 2 or 3 hours, and that's how long it takes for me to just rest and calm back down again before I have to move on to the next thing.
Your method then is an excellent additional piece of advice for everyone listening. So take time, but also be kind to yourself about that time, to not feel like you might be being selfish for giving yourself that time, or you don't deserve that time, or to feel guilty about taking that time for yourself. It sounds like it's absolutely important that that time you make for yourself, and that might mean that you don't get to do quite everything you might want to do, but you have to use this to look after yourself. So that sounds like that's something that you've learned along the way, or have you always known that being kind to yourself and having that thoughtful self-compassion, has that been something you've always done?
No, I didn't always do that. And the reason why I didn't is because the trauma stories would come up. So I notice in myself and with other people that I've worked with, they they tell themselves how stories about the feelings that they have, which are usually what we've been told by our abusers to feel about ourselves.
Okay.
And that can kind of get in the way of compassion. So one of the great things about being autistic is we're insanely curious. And so I started to become curious about, why do my parts react that way? Why do I react that way? Why am I perfectionist about getting stuff done? Why am I driving myself all of the time? And I really had to go through letting that go. And I know for me, the underlying belief was, if I could just be perfect, then nothing bad would happen to me. And I remember going through the phase of having to let that go. It
Yeah.
was very scary, but once I did, I felt so much freer. And actually, you said before, like, I might not be able to do everything that I want to do, but I actually found the reverse to be true when I actually started to practice it. I actually get more stuff done now that I give myself the rest time. And
Perfect.
it's been life-changing. So compassion really does make a difference, and it stops all of that inner chatter, because when your parts get used to having a compassionate response from you and not, oh my God, why are you making my life so difficult? They start to trust you, and it builds safe attachment with them.
Yeah. And I think that sounds great, that it's something you've learned to do, but you also given a very positive message about the autism in terms of the context of the DID, that you're using the elements of it to make some other parts of life simpler, almost straightforward, or to work through difficulties and challenges as you find them. So I mean, again, this is a wonderful message. It's not to say that, having autism DID is like doubling down on the DID and making it twice as worse because you're autistic. There's aspects of autism which can actually work extremely well in structuring and approaches towards working with trauma, working towards the past, the present, managing all of these different things. So yeah, that as a message is a wonderful thing for people to have to take on. And I think also for therapists who might be diagnosing either or both of these things, is to be able to promote that there is a positive, hopeful message in amongst all of these things. Because I suppose I can imagine, like, someone who, let's say, has DID and is aware of that there's all these things coming on, suddenly getting diagnosed as being autistic later on in life can feel like, oh no, I thought I had it bad and now it's just got worse. And what you're saying is that isn't necessarily the case.
I can understand why they might feel that way, because I came to my realization about being autistic after I'd known about my DID for quite a long time. So I knew the impact that having emotional dysregulation there would cause on my life. But with trauma, I had this hope that, one day that would be healed and I wouldn't experience that anymore. And having to accept that I'm autistic and I'm always going to have that
Yeah.
was really difficult for me. And I think it was only when I understood, like, the traits that my dad had were the things that I really loved about him,
Oh,
that I managed to accept my own diagnosis. And when I would look at other autistic people speaking about their diagnosis, saying what a relief it was, I
yeah.
felt really disconnected from that. And in some places, I even got judged for not having those feelings. But because I had that deeper understanding of how my nervous system worked, I kind of knew what I was in for. But the great side is I knew that I could cope with that too, because I've been practicing it for the last 10 years. So Mm.
There's a real lesson in practice here. It's like whatever it is that a person might be carrying, whether it's autism, DID, or OSDD, the other specified dissociative disorder, whatever it might be, is that putting time and effort in, being compassionate towards yourself, putting loads of practice in, preparing, thinking about these things is absolutely part of how we deal with it. But I suppose also you're a person in the world and you kind of have this existence within yourself. So quite a lot of this is very intellectual and very thoughtful and sort of like, you're planning and you're trying holding all these things together. You also have a sense of yourself as a person in terms of a physical sense. So how do you what's it like for you sort of being like a physical person in the world? And are there things about being autistic and having DID that make connecting to yourself either easier or harder to do?
I think depersonalization is probably the most difficult for us.
Okay.
And the way that I kind of understand the difference between depersonalization and, say, interoception difficulties is to imagine sort of two tin cans held together by a piece of string. So when I am experiencing depersonalization, it's like the string has been cut and there's nothing inside.
Yeah.
And then other times when I have managed to ground, it might be that there's a signal coming from the tin can from another part of me, but I don't understand it. And that might be because that part has the action system and they're expecting me to do something in the outside world based on their prompt, but I might not understand their prompt or their emotion. And so that takes a bit longer for me to process. The way that I started to overcome that is to understand the purpose of emotions. So, for example, if I was experiencing anger, I now know that, oh, okay, I have a sense of injustice.
Okay.
So maybe someone's crossed my boundary, maybe I need to do something about that. So I can take it from a feeling to a more cognitive thing, which meant that me as the daily life part, who is a bit more left-brained, could actually convert that language to something that I understood. And that took me a really long time. But once I got it, it's made so much difference. And then tying it back to identity, which we talked about before, or you mentioned, it when I was able to sort of tie those things together and I started to understand, oh, so these are my feelings. And now I can separate external demand. So now I have the boundary between what's me and what's somebody else.
Yeah.
And then I can say, well, that's my need, that's their need. And then I can think about, well, how do I meet both of those needs? Or there was just more clarity of who I am.
I,
Mm.
I love the fact that you mentioned about the tin cans and the piece of string because I folks that know me probably know, oh God, here he goes again. He's off on his cans. I always think about it in terms of baked bean tin. For some reason, it's always baked beans. It's never like, chopped tomatoes or whatever, lentils or something. It's always got to be baked beans. And this I think this visual construct of you're hearing one thing and there's this piece of string that's kind of heading out into your internal world. And on the other side of that, you could be getting loads of information in and out. And sometimes it might be trauma type stuff or it might be needs-based things. So I love the fact that you brought that in because I love that. That's one of my concepts as well. So we're on shared territory there. But I think what you've done there is you might have disabled a myth that a lot of people, like neurotypical people, non-autistic people, have about autism, is that you're not really able to read emotions. You're not really be able to pick up those signals and take that stuff on. Now, go with me on the question, right? So I know that there's, every autistic person has the same range of emotions as anybody else, right? Because those are just there. So there's myth, as it were, that you're not really able to pick up on those emotions and interpret and understand those things. Now, you've got yourself to do that with, your own emotions, and you've got potentially the emotions of people that are around you outside in the world, and you've got these emotions on the inside. And you might be depersonalizing and being disconnected from these things. So that's a huge task. But if we start with the thing about how do you understand and recognize the emotions of the inside world as an autistic person, aren't you not supposed to be able to do that very well? So how are you doing it?
Oh, sorry, that it makes me chuckle when people say, "Oh, well, you don't have any feelings," and I'm like, "Okay, well, I'm an empath, so I have all the feelings, and I feel all the feelings of everybody else as well." And that's part of my sensory overload that I have to manage, which is why like that boundary of what's me, what's other people is so important to me. Um, I think that what we spoke about before, where I said about converting that sensory feeling into something logical, was the key for
Uh,
me.
right.
Um, because without that kind of like conversion, I wasn't able to identify things, and therefore I wasn't able to communicate to other people what I needed, and that made me feel like I was being neglected all the time.
Okay.
And I think the reason why that myth exists is because we might communicate that we've understood that someone else might be feeling a certain way, but in a way that they don't pick up on. So it might not be that we don't notice, it might be that you can't hear the way that we are saying that we notice you, and vice versa, right? So,
Yeah, for sure. Absolutely. And the signals that we might get from you if you're in any given state that you mentioned about state shifting, or if you're any given sort of like emotional state or actual, depersonalized or dissociative state, is there a means by which you can sort of protect yourself from the outside world to try and, give yourself that space and sort of, just go about everyday life without being sort of like noticed in that when something is going on?
okay, so let's unpack that a little bit. I think that autistic people do give signals. So we might start stimming or behaving what other people would say inappropriately. That is our signal.
Right.
But
Yeah.
instead of that being accepted, often it's like, why are you behaving like that? It's not appropriate.
Yeah.
So we do give signals, but the world doesn't read them. And then because we have those signals, we expect other people to have those signals. And when they don't, we don't understand. So we might not be looking at your face and understand that you're sad. So we might ask you, and so we'll say, how are you feeling today? And
Yeah.
if you say, I'm fine, we will take you literally. So we need other people to be clear with their signals, because otherwise, the same problem with my parts inside between the tin cans is like the signals being distorted. Because in my mind, like if someone says they're fine and they're not, they're lying. You know,
Well, yeah, right.
but
It
I
is
can't
in a
go around
way.
saying everyone's a liar. So I have to be like, okay, now I've remembered that that's a social norm. So
Yeah.
I have to constantly think, well, that person might not be fine. So now I'm going to listen to what they say, because I can't do the body language and the face, like look, eye contact and stuff. I rely more on like how is the person speaking about things, like, and because I know a lot about trauma patterns, I pick up on people's nervous system energy
Yeah.
faster than I pick up on their body language. So I
Yeah.
just read different signals, basically, is what I'm trying to say. But that is a lot to process because I'm paying attention to more stuff.
Yeah.
Whereas you can just look at someone's face and how their body is and be done with, you like, I'm great, I know what's going on. Me, no, not a clue. I have to read everything else.
But it is I think it's quite a nice flip on that sense that, as non-autistic people sort of thinking, oh, you can't do this stuff very well, you can't do this stuff very well. The implication being is that we do it great and somehow you're not doing it very well. Actually, we probably both have the same challenges and the same difficulties, and we're not really paying enough time and energy and effort into each other. And I suppose that's where like knowing that you're autistic really comes in, because you've got that then, haven't you? You've got a sense, at least a sense of I know, this is how we go about things, this is how I'm doing things. So, and that helps me, like if as a therapist, to say, okay, I know I'm working with, let's say I know I'm working with them, and I know that you're autistic. So I need to be very clear and not say things which you might interpret as being lies, let's say. So us being clear and honest with each other, I mean, that's absolutely what we've got to do. And we're thinking about DID, which is often about, having really awful, terrible experiences where truth and honesty and trust are things that really are not being held. Part of what we're saying is like, if you're autistic and with DID, honesty, clarity, openness, these things are absolutely vital, really, to providing the framework for you to do well. So thinking, go all the way back. So I think we've gone off on, an amazing segue. We could probably just keep doing that forever, couldn't we? So if we go back to depersonalization and these tin cans with a bit of string in between, what happens when that string gets cut? When you're depersonalized, which is a lack of connection to the self and the body, and you've got this internal world. What happens for you when that disconnect happens, and maybe what you've got then is there's no information coming through on that piece of string? What's that like?
So I actually lived most of my life like that. I probably would say up until about 2 years ago, that was my everyday.
Ah, right. So having that piece of string is newer in a way then. Right, got it. Okay.
So the way that I dealt with it before I had that connection to the others was routine. So I did business studies when I was at GCSE at school, and they taught us two things. One was about opportunity cost, and the other was Maslow's hierarchy of needs.
Yeah.
So I remembered this, and I thought, right, I'll put my business brain on. And I'll think, right, what's my basic needs? Okay, so I build my routine around food
Yeah.
and making sure my home is safe. And I literally started at the bottom and worked my way up and built all of those needs into my routine because I had no idea what I needed. I knew the others had the action systems, but I couldn't fill their prompts. So it's actually quite new now that say like my little, she loves food, she's obsessed with it, and she'll be like, I'm hungry, I'm hungry. And then I will have to convert the I'm hungry because she's jumping up and down
Yeah.
to, okay, now I need to do an action in the external world to go and cook food. And then I will swap back to her so she can eat the food. So you just have to be more mindful about, oh yes, I've got to state shift again and those kind of things, and just build it into your routine. So I have alarms that prompt me to eat, especially
Yeah.
when I'm in hyper focus.
Yeah.
Like yesterday, I think I did 10 hours of writing. And then I was like, oh my God, it's 1 o'clock in the morning. I need to go to bed.
Yeah.
Not foolproof, but if you do it most of the time, it does help. And it's practice, you get better at it.
And if she's communicating to you that she's hungry, presumably on the outside you're the one that really has to scramble around and get some food together. If you can't get that signal, if you're disconnected, what happens to that signal? What would take place? Like, or how do you manage that?
I think in that case, she usually forces a switch and she'll go out and get food herself. So I always make sure that she has snacks available to her because if I don't mindfully choose what snacks are available to her, she'll be eating sugar and we would live on ice cream because
And
she's got.
then you might then come back after your dissociated state, and then you're full of sugar and ice cream and stuff that you would you know? I mean, would you just as an aside, like would you know that there's a load of stuff's been eaten and you've got this in your stomach kind of thing?
So I would
Yeah.
because I have fibromyalgia. So whenever she eats sugar,
Oh,
her feet are on fire.
oh
I've just
gosh.
noticed that about myself recently. But in the past, I didn't know. I might have an inkling that I feel a bit nauseous. But it would have to be a pretty severe feeling for me to even feel it at all, like on the
Yeah.
outside. So
Wow.
no, I wouldn't have always known in the beginning, but now I do.
You do, yeah. But so I suppose you've reflected a lot, and you've put a lot of effort into trying to understand and break down these feelings. And I think your that sort of structured curiosity that you clearly have is massively useful in occasions like this. So if we think about, as we mentioned about depersonalization, and I suppose one of the things that folks ask questions of on the channel is, what's the difference? How do we know whether we're just being autistic, and how do we know whether we're having a dissociative episode? And derealization is something that seems to crop up as a sort of a fairly big question within this. Depersonalization and derealization are all part of the I'm kind of talking to everybody rather than just you here because I think you know this stuff anyway. They're part of the sort of the central, like the pillars, or the foundation stones of what we consider to be dissociation. There's a lot of focus on shifting and parts and things like that, and not always the same amount of focus given to depersonalization and derealization. And maybe that creates a little bit of a difficulty because a lot of autistic folks with DID, if it's all about that parts and the switching and those kind of things. But a lot of autism sounds quite like derealization in of itself. The sensory input, the fogginess, the sound, all of the different signals that are coming in, and how that can overwhelm and how that can overload and cause difficulty being in that environment. Do you know like what you're experiencing? Do you have any sense of this? I'm experiencing this from the environment, from the world around me because I'm autistic, or would you be clear that it is an obviously dissociative derealization response?
Okay, so there's different answers for each type of dissociation. So with derealization, I would say that if I am overwhelmed by my senses, the first thing I will do is to try and reduce the amount of input. So I might use one of my coping strategies and put my headphones on or whatever.
Okay.
That gives me some sense of removal from the distressing stimuli. If I'm still distressed after that, then it might be more than just what's in my environment. There might be a trauma trigger underneath that I need to process. And it's really important that you don't just automatically always choose to avoid and get away from the situation, because otherwise you can get stuck in avoiding dealing with your trauma memories.
Yeah.
So it does take practice. I personally tend to find that when the world feels unreal to me, that's usually a trauma response because my sensory profile is heightened. And so I tend to have more, the world feels too real and too vivid, and that's really scary to me. And if it's unreal, then that's not my usual autistic profile. So I pretty much always assume it is a trauma response
Okay.
because I'm stressed out by something. But if someone else has the opposite sensory profile, the opposite may be true for them. So you really have to learn your own answers to that question.
Okay.
Then with depersonalization, I know the only notice difference that I can find is that if I'm experiencing depersonalization, I've got this void inside where there's no feedback. And that's the same if I'm struggling with my interoception. So the only time I can distinguish the two is by understanding, am I actually present right now outside in the world? And if I am, then it's probably an interoception problem rather than a dissociative issue.
Wow. There's so much that you have to do then to try and make sense of these things. But what you seem to be saying is almost like you have a sort of a checklist for what works for me. And these are my very, very specific sort of components of all of these items. And it might be the exact opposite for somebody else. But it's so important to sit and actually work out the individual unique nature of this for yourself. So we would be talking realistically about that being a person-centered model, so that we have our general sense of theories and our ideas about things, but it's absolutely centered on your personal lived experience of each one of those things, and to work through that. And I just wonder how much that actually takes place, and whether that's in your experience, because I know you've had therapy before you've come to the CTAD clinic. Has that been your experience that there's okay, perhaps not. Yeah, that the smile says it all. What I mean, what has been your experience of this in terms of being this unique person in therapy? Is that yeah, okay, just give me what you got.
Okay. My first experience of counseling was that I did CBT, which
Right.
was very like you need your front brain online, you need to be able to process things. I just did not have access to my front brain. And
Yeah.
when I did by chance remember what had triggered me, because I didn't have the dissociative amnesia there, I didn't have a flipping clue what it actually meant. So doing the ABC model drove me literally nuts. And I was like, please, no more CBT. It was too much for me. And
Yeah.
I think that my second experience of counseling was much better. The lady that I had was so wonderful, and she focused on helping me like reconnect with my body. And that was the first time I'd ever felt my body. The
Ah,
only thing she didn't warn me of, and I wish I'd known this in hindsight, is when I reconnected with my body, I also got all of my emotions all at once, which was quite overwhelming.
yes.
So if anybody is going through that process, I'd like you to be prepared for that. So maybe like teach people what their emotions mean before they get to that stage, because it's going to come back.
Yeah.
And then
But
obviously with working with the CTAD clinic, it's completely different because you actually have the skills to like pick apart, what's trauma, what's autism, and you're better at being present with us whilst we work through that process, because I think most people that I've come across don't even really understand autism. And
yeah,
when I
I think
for
so.
my first psychiatry appointment, which I needed to go through that process to get here, I was told that I couldn't possibly have trauma because I was delusional, because he didn't understand that my parts were actual real entities. So
Yeah.
he thought that
Um,
it was
okay.
voices in my head. And then he told me I couldn't be autistic because I was developmentally delayed to the trauma that wasn't really trauma because it was a delusion. So this kind of misunderstanding is everywhere. And I was told that I was an intimidating patient. So I didn't really understand why, but that was my experience before I got here, was just confusion from other people. And
Wow.
so in a way that was great for me, because I was like, right, well, I want to know the answer, even if you don't know it. So my special interest suddenly became DID and autism joined together, and which is how I've worked all this stuff out for myself.
And I'm really glad you have, because the opportunity of being able to sort of share this out and let people know about this. Because the key in this is like, yeah, we can read, like, I'm not autistic. So for me to understand what autism is, I can go read books about autism and I've got a lot of information about that. But I think central to it is just asking the person what it's like to be your version of autism in a way, rather than just like all autistic people are inherently the same. And there's, what effectively what you're saying here is, your autism can be completely different in how it sort of like organizes and understands the world than another person's. And the key is to ask and then sort of listen, which is exactly what we want to do with that person-centered thing. And I know CBT can be a little bit structured and can be a little bit programmed in a way, is that, there's like a method and there's a program that people follow and a manualized approach type things. But with trauma, we have to be able to work around that field and not put you into that. It's got to be done alongside you and work with you. And all the time and effort you've put into that is about teaching us as therapists how to do our job better. And I love that, because that is the collaborative approach that I think all trauma therapy is based on. And especially with DID or OSDD or these kind of high level trauma type conditions, because everyone's experience of their own life has been so different. And the nature of trauma is that, what might traumatize one person might be a nice day out for another person, because it's entirely dependent on your own experience for things. So autism and DID are like, it's a doubling down of things that you need to ask, inquire, and be curious about. So you're super curious. It's up for us to be sort of curious at the same time, isn't it? And there's a lot we can learn from each other, which is exactly why I think this interview is really helpful. So let's jump back into some of the things that we wanted to work on with your internal world and your autism. A question that comes up from time to time, and I think from both autistic people and non-autistic people, is if you're autistic and you've got DID and you've got these parts inside of varying, ages and types and various different things, can they be not autistic, or are they always going to be autistic? I mean, what's your answer for that from your experience?
Well, I find that notion kind of illogical, because if
Okay.
my brain's autistic and they're in my brain, they must also therefore be autistic. However, I can see why some people might feel that that might be the case, because I don't want to invalidate someone's experience if they feel that about themselves.
Hmm.
from the kind of work that I've done with my parts, I would say that a lot of our parts have different levels of masking based on the action system. So they
Oh,
might be more highly skilled at certain things. Like I had one part who was great at socializing and she didn't look autistic, but she was. And
oh,
I could feel the cost of socializing when she like came home and I was present with her. I knew how much that cost. And so she was still autistic. She just didn't look it on the outside. And so I very much do feel that all my parts are autistic, especially like some of the little ones. You
sure.
can really see it with them. Yeah.
And that does make sense, doesn't it? Because dissociation is something that occurs as a result of experience in life, but autism is built in. I mean, it's the autistic brain occurs from the off and is always going to be autistic. So dissociation is something that occurs along the way. So if we're thinking about how a person becomes dissociative, an autistic person becomes an autistically dissociative person. I mean, you're going to be autistic, so your parts will be. You mentioned masking. Now, I have an understanding of what that is, but it might be that some people watching this video don't necessarily know what that means. It's a very commonly used term within autism. Would you be able to give us a sort of a very brief, like elevator pitch type definition from your perspective about what you think masking is, just to help people understand that terminology?
Okay. So I think everybody has a different version of themselves that they are, say, like at work or out in social situations. But masking's different. It's hiding the self in order to be socially acceptable. And often it's come from being told that we shouldn't behave a certain way because it's not what's expected of us. But that's actually what we need to regulate our nervous system, is to flap our hands around, jump up and down, or whatever it is we need to do. So that kind of false sense of self can really become problematic when you start adding in DID and you don't really know who you are because of the identity confusion that comes along with trauma.
Yeah. Brilliant. So I can see how much effort goes into this, and it must be quite exhausting, and to just be able to manage that, because that's a almost like a lifelong challenge. Like when you're out in the world, you have to do these things. That makes sense as to why some parts might not always appear to be as autistic, because actually, and it could be that a part is really highly invested into attending appointments and things. So it could be that you've got one of your parts who would be autistic. So we've established it can't not be realistically, but they can mask as to be as sort of non-autistic as possible, to be ordinary, socially acceptable, as you said, to not really, not really show any of the autistic stuff, because that draws a lot of attention, and attention is often quite threatening with people with DID. So this part could be out in the world masking, and you might never really get the sense from professionals that you are autistic, which can be a big barrier for treatments and things to be working. So like you mentioned about CBT, well, a lot of CBT is about going and doing the thing that you find difficult. But if you're autistic and the reason that you find a thing difficult is because of autism, if CBT is basically saying to you, just keep doing it and doing it and doing it and reflect on the process, and eventually it should get easier, because that's the graded exposure theory of CBT. If we don't know you're autistic, aren't we both going to fail? I mean, isn't this just going to not work?
Absolutely. And you're going to re-traumatize us in the process, most likely, which is
Right.
quite unfortunate. And that was definitely my experience. And it's hard because, before you realize you're autistic, you don't know you're masking. So you go along to the doctors and you're all hopeful,
Yeah.
thinking, hey, they're going to help me. And then they go, well, there's nothing wrong with you. Why are you here? And send you home. And I went through years of that for everything, like all kinds of illnesses, not just mental health, just like my fibromyalgia and stuff like that.
Yeah.
And I think doctors have to do a better job
I
of
agree.
like asking questions and
Yeah.
not just taking us on face value.
Yeah,
And
I
then,
agree.
sorry, I didn't mean to interrupt you.
No, 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 sorry. I was just agreeing with you.
I've forgotten what I was going to say now. It's okay. It'll come back if it's
It'll come
important.
back. It'll come back. Um, So one of the things that has just cropped into mind is because we have this like trauma focused CBT. So what we need to be almost calling it is like trauma focused CBT brackets, find out whether the person is autistic before you start this process, close brackets.
Yes, although in my personal opinion, I don't like CBT for trauma because it requires your front brain to be online. And I have noticed a pattern with people that I've worked with who
Mm,
are DID and not autistic, that often means, oh, I'm following this model, but they forget the trauma wrapper around it, where you do safety and stabilization first. Then
yeah,
the CBT should be the trauma work if that's the model you're going to use, and then you do the integration afterwards.
yeah,
I know in my experience, the safety and stabilization, it was mentioned as a concept. Oh, this is what window of tolerance is. Do this grounding exercise. But because I think differently, giving me a
mm,
generalized concept of do these types of like stabilization techniques didn't mean anything to me whatsoever. And if you're going to treat an autistic person, you have to do therapy upside down. You
yeah,
have to do detail upwards because that's how we understand the world. Otherwise, we're going to feel like you're, well, sort of empathetic failure, really, because
yeah.
we're going to think that you don't understand us and we're not going to understand you. And that's going to feel threatening. And how do you build a safe attachment in therapy if you can't communicate with each other?
I agree. I think it makes it enormously difficult to be able to do just that. So really understanding these concepts and breaking it down and understanding each other properly, almost without the labels, right? The dissociation, the DID, the autistic labels, to be able to just sort of see each other as two people that are sharing our experience so that you are what you are. And yes, it happens to have autism. Yes, it happens to have dissociation. And yes, it happens to have trauma and those kind of things. But essentially you are you and trying to understand and connect to that is that attachment. And for it to become safe allows all the other learning to take place. So I'm interested really, before we finish up, is sort of what you've learned about yourself throughout this process, because you've come to realize that you're autistic. You've always known that you've had trauma. You've always known that that there's been this other world because you've been listening in on it and you've been sort of trying to make some sense out of these things, and you've built your experience and your knowledge as you've gone along. What's it like being you, and how do you see yourself, and what sense do you make of yourself having learned all of these things?
That's quite a big question.
It is, isn't
I,
it? Sorry.
yeah.
You break it down if you want to.
Well, I'm gonna, because that's the way my brain works. So I would say that I think before I knew I was autistic, I tried to teach myself what the components of identity are. So
Yeah.
what are my core beliefs? How how do I want to use my choices to enact those core beliefs in the world and be my own sense of like autonomous self because I
Yeah.
didn't have my trauma. So I learned that. But when I had the depersonalization still going on in the interoception, it was really difficult for me to have the boundary between what's me and what's other people. And so
Right.
my ability to actually be myself in the world was stunted. But getting my diagnosis and understanding that I'm autistic, I became able to start to do that because I was mindful now of, oh, that's the boundary of them, that's me. I understand my emotions. I understand why my emotions are present. So now I know what to do with them. And I can use my logical brain to kind of orient the world. And I think that really made the difference because before I knew that, I didn't leave the house. I was so overwhelmed all the time. I had no idea why. Every time I left the house, I felt overloaded by sensory information. And now that I can separate those things, I have a life that I really love. I go to art groups, I have lovely friends there. I do meaningful things that I know are important to me because I've connected with those values.
Yeah.
And I think like coming to the CTAD clinic just changed my whole life because I feel like actually a whole person now. And being able to let down my mask and choose to show my true self to
Yeah.
people is really empowering. But I don't always choose to do that because it's not always safe because I don't know everybody that I come in contact with.
Cool.
Even just knowing that I have that vulnerability, but I can choose when I want to protect myself, I think that's so empowering.
I'm so pleased to hear that, Em, because it feels like choice is just one of those things that trauma doesn't give people. You know, you're in that traumatized situation. You don't really have a lot of choice. If you had the choice, you just leave it and you would be less traumatized. So we know that choice is really not a factor in most people's experience. For you to be able to keep using your skills, so some of it is dissociative, some of it is autistic, but you have a knowledge now and an ability to be able to add things or bring things up or lower things according to what you actually need. You've developed a sense of what you need then as a person and as carrying a system within inside you. And that's absolutely wonderful. And I think as a message of hope, really, because that's often a very, very difficult thing for people to be able to hold and to have and to experience. Certainly in the early days, like maybe newly diagnosed or, entering therapy for the first time, hope really isn't there. I mean, we as therapists might hold a lot of hope, but people often don't really even understand what that concept feels like, or find it too threatening because, the sense of failure that can come with hope being not achieved. What you're doing in this interview, what I'm hearing, and I hope people are hearing outside, is that you can get to a point where it works out. And again, that's another question that we hear is that, does it work? Can people become better in whatever form that might actually look like, to get to a point where you can move from feeling quite hopeless and feeling quite overwhelmed and just completely out of it, and then to a place where you can be in charge of your life and you have to do all these things. You still carry your backpack. So you might, you're doing great, clearly, and you're functioning and you're managing the world and doing a load of things that you enjoy, but you still carry your backpack with you because you're going to need that. As a message to people to say that you can move from being somewhere that feels entirely hopeless to being in a position of feeling hopeful about things is a wonderful thing. Can you offer maybe a piece of advice or a hint or something or a tip or something like that someone who might be in the early stages of the journey that you set out on, what would be something that you've learned along the way that you'd like to sort of get across to that person?
Well, the most important thing is to be patient with yourself and show yourself compassion. You are not going to get it right the first time. And I know your black and white thinking is going to make you want to be perfect every time, but it's
Yeah.
not realistic for anybody, autistic or not. And I think, that's a difficult phase to go through. It's painful because often trauma makes us think, if I could just be perfect, then bad things won't happen to me. And
Mm.
letting go of that means letting go of the sense of control you have over an outcome. But it's really important to do, especially if you're autistic, because you need to get out of that black and white mindset and
Yeah.
then being compassionate to yourself. So one of the things we did was we treated everything like an experiment. So we
Right.
did a little test to see if we liked something, and if we didn't like it, we were allowed to discard it. And that helped us manage our demand avoidance as well. And it also like lean into your special interests because there are some
Mm.
amazing things about the autistic brain. Special interests are an amazing way to access joy and positive emotions and let them be tolerable to you,
Yeah.
which like non-autistic people don't have that. And then I would say be wary of your vulnerabilities, but don't hyperfixate on them.
Okay.
Come up with a plan, lean into your routines and rely on your routine, and you'll be fine.
You'll be fine. Brilliant. And yeah, so it's taking time, being patient, being compassionate, finding the things that you love. And I can see how with autism and DID, those two things combined, how important that is, because there'll be many different things, and there might be things on the inside that are loved by a part, but not necessarily loved by yourself, on kind of like, hosting the outside world and being that buffer. But being thoughtful and compassionate about all of those things to have some confidence that this can actually work and that you can do well with this. I think it's a beautiful message, and probably a really nice way for us to end up end our interview today. I'd just like to say on behalf of myself and whoever is watching this and whoever is sort of learning from this, that it's a huge appreciation for you to give your time and effort to sitting here and answering all these questions from me and picking up some of the questions from other subscribers on the channel as well. So I'm sure that there'll be lots more questions coming. So we have, when we have these videos, I always sort of say, for folks to leave comments at the end, so that they can sort of put some comments and some thoughts and some reflections and often some of their own experiences in that channel. And those are really helpful for lots of people. So I'll pass on any questions or anything that crops up from this, and you never know, we might sort of come together again and sort of answer some like detailed questions that might come about. But for the moment, I'd just like to thank you very, very much for all of your time today to sort of help educate all of us about autism and DID, which I think is a very, very necessary topic, and there just isn't enough out there. So you've provided some great information, some insight, and some hope for many, many people who may be watching this. So to everybody out there watching the channel, please do all the usual stuff, and like, subscribing, sharing, and you know, maybe sit, if you're autistic and you have DID and you have a therapist, maybe sit and watch this with them and help your therapist sort of understand some of the things that they might be able to really do that would sort of progress your journey. I'm sure that would be appreciated. And to you know, just continue putting comments down and let us know what you think of this video. We'll keep making the videos, and I'm sure autism is going to be something which will be a regular part of the work that we do, because it's so intrinsic to a lot of the dissociation and trauma work that we cover. So thank you very much for watching, and we'll keep producing the videos, and in between now and the next one, please do take great care.